So if you're one of those people who act as if COVID-19 isn't as dangerous or fatal as it is, I urge you to look at the pictures we are about to show. They're taken inside a COVID ward. It's not something that you get to see as family members and journalists are prevented from going in. But these images really are a grim reminder to stay at home. A medical worker inside the ward described it as the abnormality of seeing people die at this rate. So let's speak to Shiraaz Mohammed about what he saw inside the Klerksdorp Tshepong Hospital. A very good evening to you, Shiraaz. Tell us a little bit. I saw your pictures and read what you had to say. It was a very disturbing pictures. Tell us more about what you saw there.
Hi, good evening. How are you?
Good, thank you.
All right, so it was very disturbing looking at people laying unconscious, pipes running in their mouths and them fighting for their lives, their life depending on machines to survive, and them laying there helpless also.
I mean, do you think we can?
Images.
Do you think we can imagine? Actually, if you haven't been inside, can we actually imagine it?
You're not going to imagine it. You'll never imagine it, and it's images that can haunt you for the rest of your life, if I'm not sounding dramatic.
There's a lot of talk about people sitting outside waiting to go in. Did you see that in many hospitals around South Africa?
No, I didn't see that.
Okay. And I know that you spoke to some of the medical staff. Tell us what they had to say.
Yeah. So the medical staff are under they're under a lot of pressure, and they're finding it difficult to cope. Just excuse me.
Yeah, I should imagine it must be pretty traumatic to see that and see as many people dying as they do.
Yeah.
What do you think we're missing out by not allowing journalists into hospitals to see what's happening?
Okay, so by not allowing journalists into hospitals, we're missing out. We're not seeing the bigger picture. We're not seeing what's happening behind closed doors. We heard of patients that don't have beds. They're getting treatment on the floor, and that. We're not really seeing that. We're not seeing the pain that the doctors go through. We're not seeing the pain that the healthcare workers go through. We're not seeing their frustrations. We're not seeing their tears. We're not seeing their anguish. Doctors and that would love to speak to media, but they can't because they face disciplinary actions and things like that. So, as a journalist, and I'm sure that there's others in the country also that would agree with me, it's very frustrating us not able to gain access to facilities.
And I know that there's a lot of fear surrounding doctors speaking out as well. I mean, from what you saw in that COVID ward, do you have a message for South Africans after that?
I'd say death is closer than what you think. People take COVID for a joke, but it's not. And if you look around you and you see how many people are dying, it's shocking. So, in my opinion, I'd say the best thing is to self-isolate.
Okay. Shiraaz Mohammed, very good to talk to you. Thank you for sharing your experience with us. It's so good that a journalist was allowed in, and your powerful pictures. Thank you.